Apologies for the little delay. Zoom likes to do their little updates. We would like to welcome you to the Anew Advisors webinar education series. Thank you for joining us today. My name is Liz Notling, and I am the Director of Operations for Anew Advisors. Today, our webinar will be focused on health insurance in retirement. Just a few housekeeping things before we get started. Today's webinar is recorded. During the presentation, you may ask questions via the chat. Otherwise, at the end, we will open it up and you can chat with the chat box, or we'll unmute you and you'll be able to go. Just make sure this is all set. And again, health insurance and retirement. We have a couple things we'll be discussing today: who we are, healthcare basics, pre and post 65 health insurance, and next steps. This is our team. We like to give a little visual of who we are, especially when you're getting emails from us, and a little bit more about who we are, our mission, vision, and values that we like to share. As a reminder, Anew Advisors came to fruition in 2020 as a combined experience of over 60 years in both the public sector and private sector, working with organizations, private organizations, individuals, and first responders. And I'll have Nick Schneider go ahead and take it away.
Yeah, thank you all for being on today. We're going to divide this up really into two sections. We're just going to do some basics of health insurance, and then really where are you looking to get health insurance, right? So for our people that retire before 65, a lot of first responders, they retire at 53. Even if you're in the private sector, you might decide to retire at 62 when you start to be eligible for Social Security, but then you might have to find insurance in the meantime until you get to 65 where you're eligible for Medicare. So we're going to just go through some, basics, things you're going to look at when you're looking for insurance, and then how do we actually get it. Next slide, Liz. So just some basic vocabulary. These are kind of the key words and phrases you're going to need to know when you start looking for insurance. The first one we're going to talk about, premium. Most of us are familiar with premium. That's what you pay the insurance company every single month to be able to provide coverage. And it's more often than not, the first thing people look at is, okay, how much am I going to pay in premiums to get my insurance? The second thing that people tend to look at is your deductible. And this is going to be the amount that you will need to pay yourself before the insurance company will start taking over any co-insurance or payments. The next thing you'll see pretty often is copay or copays. These are not on every plan. Some plans have them, some plans don't. So depending on your plan, you might have copays. And what these are is basically a down payment for service. So if you see the word copay on your insurance card, you might see where it says like $25 for an office visit. It might be $75 for a specialist. It might be $10 for prescription drugs. And what this is what you're going to need to pay that day to receive whatever service that you need. You will still often receive your bill afterwards, because it's not often that copay covers the entire cost to be seen that day. But again, that depends on where you are in your deductible. The next amount is coinsurance. So what happens is after you meet your deductible, so let's say you're on a plan where your deductible is $1,500. After that $1,500, you're going to see what's called coinsurance. And that might be a number. It's going to be 80-20, 70-30, 60-40. What that is the percentage that the insurance company pays on your bill after you've reached your deductible. And that number goes until you reach your out-of-pocket maximum, which is the maximum amount you will pay before your insurance coverage takes over all payments after that. So those are the main things when you're looking for insurance. These are some of the big words you're going to want to keep in mind, because this is what's all going to kind of work together between what your total cost is going to end up being. So the next thing we need to talk about is types of networks. Now that we kind of know how each network is going to bill us and make us pay for certain services, we need to know what kind of networks we're joining. And these are the 4 major types of insurance networks that you're going to see. The first one is your exclusive provider organization, or an EPO. These are becoming less common, but these have you work with a very specific amount of services and providers in a network. And then there is typically very rarely out of network coverage options available where there's even any sort of discounts that are provided. So EPOs are going to be our most exclusive and ultimately most restrictive, but they sometimes offer the best in-network benefits. The next one is going to be your health maintenance organization. This is one of the more common ones that people will know. This is a little bit larger plan, but it's a type of health insurance plan, like it says, that it limits coverage to, again, a certain number of providers. And typically it's in an area, right? So an HMO might only be exclusive to the state or the community that you're in, or a particular set of providers. So like around here, like Aurora is one where you can go directly and get a plan, but that means you can only go see doctors and specialists at Aurora, and they're going to have more benefits that are based on wellness. So HMOs typically have really good benefits for when it comes to preventative care, like going in, like your physicals will typically be cheaper. Any sort of routine exam, sometimes blood work, is able to be provided at a little bit cheaper cost because you're in a very specific network with those providers in that area. The next one is going to be point of service. This is where the network can start to get a little bit more open. The networks get a little bit bigger. The downside to these is they pretty much have to start with your primary care physician. So it is more on the primary care physician once they're in this point of service network to know that who they can refer you to. So some of us, you know, when you go onto your network, you might know like, hey, I need to see a dermatologist. They are going to need to send you directly from your primary care physician. So instead of you being able to go maybe just call a dermatologist yourself that's in your list of network providers, if you're in a POS network, you got to call your general doctor first, get in with the general doctor, and then they will refer you to where you need to go. The last one is our PPO network. And this is probably the most common one that you're going to see. The reason being is it's often provided by some of the biggest providers. Most of your like Aetna, Blue Cross Blue Shield, Humana, they're going to offer a PPO network. It's normally a much wider range of doctors and facilities that you can use. And often these are the ones that allow you to go out of state. So particularly if you're someone who goes from state to state, travels a lot, or you might spend part of your year in retirement in a different state, you might go to Florida or Arizona, typically somewhere out of the Wisconsin winters. You're going to probably want to look for a PPO network because that's going to give you the most options for providers. So now, where are we looking for insurance? How are we going to get it? Now that we know, some of the key words we're looking for, how some of it works, and what the networks are, the next step is whether we're pre-65 or we're at 65 or later, how do we actually go about making sure that when we retire, we have health insurance coverage? So pre-65, one of the most common ones you're going to see pre-65 is some sort of way to stay on a current employer insurance. And this could be for either you, which is what we'll talk about briefly, or a spouse. We see spouses a lot if someone's going to work a couple extra years. So if you're at 62, someone might work till 65 in order to maintain health insurance coverage. It's one of the biggest expenses that we see is how are we going to pay for health insurance premiums? And if something happens, that out-of-pocket maximum pre-65. So a lot of municipalities will offer retiree healthcare, and it's going to be at some sort of rate that has to do with maybe a rate reduction based on sick pay they have left. You might have a VIBA provided that will allow you to pay insurance costs, including premiums, deductibles, co-pays, or any other sort of medical expenses can be paid out of your VIBA. But it's going to be still provided by the municipality. It happens in the private sector too. So when you're negotiating benefits, maybe it's a career change later in your career, it might be something you want to consider, because staying on these group plans is going to be cheaper than the next two options we're going to talk about, whether it's public or private sector. COBRA will allow you to stay on your current plan, but it's typically at the full rate. So what the rate you're paying right now that's getting deducted directly from your paycheck is at a reduced rate because you are on a group plan if it's through your employer. So they're able to aggregate everything together and give you a better rate. At COBRA, you're going to get the same insurance, which is probably better insurance than you're going to get out in the open market, but at a reduced rate because it's a group. COBRA, you don't get that rate anymore. So you're going to see a drastic increase in your insurance premiums, and it's only available for a short time. So where COBRA is useful is if you're in between jobs, you know it's only going to be a month or two, it will make sense to still take the COBRA to make sure you have insurance in the short term. But when you typically need to go past a few months, you're going to start looking at, okay, what are some of my other options to get insurance? And that's where more often than not, people are going to be looking at the Affordable Care Act. So how you get, this is basically your Obamacare, right? Affordable Care Act or Obamacare, and that's going to be through healthcare.gov. So if you go and just even start exploring the site, you're going to start to get familiar with what your rates may be. So, and this is really important for more of our public sector, our first responders, because municipalities, you know, if they stop offering this post-retirement health insurance, you're going to probably end up on the Affordable Care Act if you can't get it from your spouse, is going to be the most cost-effective way for you to get insurance coverage. So when you're out looking on the Affordable Care Act site, everything is broken down into a tier. You're going to put in all your personal information. They're going to want your name, address, social security, income levels. And then they're going to start assigning tiers of insurance and letting you know all those words we talked about, right? What the premiums, deductibles, copays, out-of-pocket maximums, what all those numbers are going to be. And they're going to divide it into a tier. So bronze tier is going to be your lowest tier, but it's going to be the lowest premium and highest cost of care. So this would be something like, say you're generally healthy, you take care of your physicals, you're okay going and doing the preventative stuff you need to be doing. You can pay, you know, still some pretty low premiums, but then what's going to happen is if you do have something happen, your out-of-pocket maximum is typically going to be higher. The deductibles are going to be higher. Some plans out there, the out-of-pocket max and the deductible are the exact same amount. So you might see something where your deductible goes all the way up to $8,000, and that's also your out-of-pocket max. So that means there's no co-insurance. You're paying every dollar all the way up until you hit the out-of-pocket maximum. And then at the highest tier is the platinum. And these are going to have your highest premiums, but they're going to be your lowest cost of care. Now, what's nice about these in the Affordable Care Act is there is no pre-existing condition anymore. So if you know you're sick, you know you're going to have some of these expenses, or like diabetes, for example, you know, some of these high costs of care, annual maintenance diseases. This is where looking at the platinum coverages and making sure what you have might be a good option, because you know as a family you're going to hit these out-of-pocket maximums. And some of this too is based on family history, right? Knowing what the risks are for yourself. But then after that, it's just based on geographic location. That's the biggest determinant of premium. It's age and location. There is no pre-existing condition for any of these Affordable Care Act. One I don't have listed, but again, is an option, is you can go get private insurance, but a lot of it you need to be careful because some of it's not actually considered health insurance. Or there are co-ops out there, some are better than others, where you're actually just with a group of people, everyone is paying premiums, and then the co-op board might be deciding, you know, what's covered, what's not. Some of them are very good, some of them are not as good. So while there are some options outside of these, you just need to really make sure you're doing your research. But no matter what you decide, one of the best things you can start to do is making sure you can calculate your total cost of care. And what I mean by that is, like, what if something happens and we go up to that deductible? The quickest way to compare plans is looking at what are my premiums for the year, so your monthly premium times 12, and then what is that out-of-pocket maximum. So when you're comparing plans and what the potential total cost could be, it's going to give you a quick comparison, because sometimes your lowest premium plan with highest cost of care, depending on what the out-of-pocket max is, might still be less expensive for you than the highest premium, lowest cost of care. And this is something where if you have questions, if you have someone you work for health insurance, that's great. We can provide assistance as well. We can help you do some of the math, and it's something that we've definitely helped people with before. So if you have questions on how to do this, don't hesitate to reach out to us as well. The next is Medicare. When you hit age 65, this is really the layout of Medicare. There's going to be Part A, Part B, which is original Medicare. And then there's additional coverages. There's med sups or medical supplements. And then Part D, which most people know is your prescription drug coverage. But then the newest plans that are starting to become the more popular option around the country is actually Medicare Part C, or Medicare Advantage plans. And those are the ones you see a lot of these commercials for, with someone like Joe Namath telling you about what you can get for Medicare coverage. But we'll cover all these briefly here so you kind of know what you're looking at when you start looking at Medicare. So Part A, this is essentially your mandatory part of Medicare. And this is for or need hospice care. This is the required part of Medicare. Now, what is it going to cost you? Paying in to Social Security for 40 quarters and you're fully eligible. There's no premium for Part A. This is provided to you. But now what some people don't know is that if they haven't been paying into Social Security and they might have less than 40, so if you're between 30 and 39 quarters, you're going to pay $278 a month for this part of Medicare. And if you haven't had 30 eligible quarters of work, you're going to pay the full cost of Medicare Part A, which is $506 a month. And what happens is this is directly deducted. If you have Social Security, it gets deducted from your Social Security check, or if you're not receiving Social Security, they're going to send you a bill. Now, for some of our first responders, I'm going to have you drop back for a second, Liz. For some of our first responders, this can be kind of scary, because if you've been a career first responder, you might not have 40 full quarters in between, pre-becoming a first responder, and then if you work for a few years after, there's a chance you might not hit those 10 years of payment into Social Security. But if your spouse is paying in, you can fully qualify if your spouse has hit that benefit. So there is still a good chance if you're married, you might not have the premium still for Part A. So keep that in mind. So then we'll switch over to Part B. So Part B, while technically optional, you're going to want to take your Part B coverage. The reason being is the insurance companies will do a lot of what they can to move something into Part B of Medicare. And at that point, if they do and you didn't elect the coverage, you are going to have to pay the full cost of that benefit. And ultimately, it's not egregiously expensive based on your income. And this is going to provide for a lot of the stuff you're probably going to need for the first few years of your retirement. Part B is going to provide for all your preventative and doctor visits. If you need outpatient surgery, emergency care is not covered under Part A. That is a Part B benefit. And then medical equipment. So make sure that you are taking your Part B, because it can affect what Part A will actually kind of help you with, and Part B is probably going to be more important. But there is a cost. And so in 2023, you're going to see if you were married, filing joint, $194,000 or less, this comes to $164.90. Or if you were an individual, anything less than $97,000 a year, it comes to $164.90. And then if you were in that second tax bracket on $194 to $246, you're looking at $230.80 if you're married filing jointly, or between $97,000 and $123,000, $2340, and then it goes up from there. And they update these charts every year, so you'll know exactly what you're paying. So then we're not going to go to C yet. The next thing that was kind of introduced is always going to be our supplements and Part D. So supplements, think like if you need special services or coverage, there's supplements available. But what most people want to know is Part D, because at this point, most people are taking some sort of monthly regular prescription drug. So now Part D coverage is a little bit different than the other two, where it's really government provided. Once you get into Part D and the supplements, they're going to be provided by your big carriers, right? Again, your Humana, Aetna, Blue Cross, Blue Shield, companies like that are going to be the ones providing your Part D coverage. So that's why when you look at the costs, there's the administration cost that's handled by Social Security, which is the $12.20, and then like your plan premium. So when you're going through Part D, it's going to be important to have a list of the prescription drugs that you need, so you make sure you get the right coverage, because you're going to have, you know, there's going to be potentially even some deductibles on top of that premium. So making sure you're getting everything covered that you need and you understand the coverage that you're getting for Part D is important. So then the last part of Medicare, and this is where the industry is mostly going, and it's this Medicare Part C or Medicare Advantage. This is going to look and feel a lot like your current health insurance coverage. It's going to combine everything under one roof provided by one of the big insurance carriers. You're going to pick a network, right? It's going to be another HMO or PPO network provided by one of these. And then it's going to include everything. It's going to include Part A, it's going to include Part B, and it's going to include Part D. And then often you're going to have plans that are going to offer, if you need vision or you want dental, that is all going to be included in these Medicare Advantage plans. And that's why more people are going this way. And the premiums are going to be more suited to what you need, right? So someone that's healthy at 53 is probably going to need someone that's, you know, unhealthy at 65 trying to find coverage. So that's where most people are going. The costs aren't that much additional, and sometimes they can even be less because you're basically getting all your providers at one stop. So it's going to provide better ease and more often more access. So that is in brief what we wanted to cover today. Just a real high level overview of some of the things you need to know. Again, you'll all get emailed this out. Slideshow will be in there with the presentation we went over today. So that way, when you're going through and thinking about some of these things, you know, what you need for coverage, you can reference it. We can send the slideshow out as well. And then obviously you can use us as a reference. You can give any of us a call and we can get you to the right people to help you select your health insurance, whether it be we can help you through the Affordable Care Act website, or at Medicare age, we can get you to the right people that can get you on the right plan to make sure that everything you need is going to be covered. So if there are any questions, you can raise your hand or you can throw them in the chat, whatever you'd like to do.
Chat is open, so feel free to chat away. Otherwise, you should be able to unmute yourself and ask questions.
All right. Well, excellent. I don't see anything coming through. Again, if you have any questions at all, feel free to reach out. Oh, we have one here. Length of time COBRA is good for. I believe the limit on COBRA is 18 months. Let me get a quick answer for you here for sure. But typically people don't like to stay on it that long because it is expensive. Yep, 18 months. So you can get 18 months of continuous coverage through your COBRA. And again, some people it works great. Some people it ends up being pretty cost prohibitive. So if you're going to be under 18 months, I'd recommend calling someone just to kind of see what other options are out there. All right. Excellent. Well, thank you all for your time. Again, reach out to any of us. You can reach out to Mike, Sean, myself, Glenn, any one of us will be happy to answer questions for you. And, you know, if it comes to the actually purchasing a Medicare Advantage plan, we'll get you to the right people in your area that know your plans, know your coverage, and we'll get you on the right plan. So thank you again, everybody. Tune in next month for our quarterly market update. And in the meantime, again, feel free to reach out with questions.
Thank you. This concludes our webinar.